I think I'm going to get started. Welcome to the CUGH workshop on using free IPUMS data for international health research. I'm Anna Bolgren, and I'm the project manager for the IPUMS Mixed Data Collection, which is part of the IPUMS Global Health Projects. Today, my colleagues and I are going to describe and demonstrate some of the free data resources from IPUMS. IPUMS is based at the Institute for Social Research and Data Innovation at the University of Minnesota. Here's a brief overview of the plan for today. We'll start out with about 70 minutes of presentations about IPUMS and the different IPUMS data collections. I'll then pass it along to my colleagues to introduce themselves and the data collections that they're most familiar with. Then there will be a short break before Dr. Miriam King will walk through a web demonstration of the IPUMS DHS website for data discovery and download. And after another quick break, Dr. Shula Sarkar will demonstrate resources for geography and GIS exploration and the IPUMS online tabulator. We will reserve some time at the end for Q&A. If you have any questions throughout, please use the Q&A feature in Zoom to ask those questions at any time. We will be monitoring the Q&A throughout the webinar and will attempt to answer questions as possible. If we don't get to an answer during the webinar, we'll follow it up at the final Q&A time. We do plan to make this recording available for all of the registered participants. If you're having any technical issues, you can put that information into the chat and we can try to help as much as possible. All right, jumping straight into things. First of all, what is IPUMS? IPUMS as an organization has been around for more than 25 years. So IPUMS now is more of a brand name, but it originally stood for the Integrated Public Use Microdata Series. The organization got its start working with US Census public use microdata files, and the vision was to integrate all of these census files together so that analysis could be conducted over time. The integration means that variable names and codes are made consistent across time and place. Public use means that the data are anonymized. And microdata is a form of individual level data, as in we have information about the characteristics of individual people as opposed to aggregate level data, where you might have a table of counts of people living in an area or counts of people divided by age or income groups. Because we work to integrate data over time, users are able to pool the data from different places and times into one data set to create a series. In the years, we've greatly expanded beyond just the US Census files, and we now have a huge variety of data collections that include both census and survey data from all over the world and on many different topics. You can find survey data on labor force, health, time use, global health, and a lot of other topics. We also have 2 aggregate data projects, which provide tables from the US and international agriculture and population census data. In this workshop today, we're going to primarily focus on the International Census and the Global Health Survey projects to show how you can access all of these different data collections. The best news about all of our data collections is that they are completely free because we are entirely grant funded. I'm going to say that again. We never charge money to access any of the data. We also want to make the data easy for researchers to use. We make all of the data available to download on our easy-to-use website that we'll be demonstrating later today during this workshop. The primary goal is to integrate data over time and place. In addition to integrating data over time and place, we also conduct extensive research and documentation into the systemic and accessible ways that a variable might appear over time and across place. This documentation lets researchers learn more about different variables, and then also compare different countries at a glance. On our website, you aren't downloading the entire survey or census sample. You're only choosing the variables, countries, and years that you're interested in. And you can download that data in a format that you want. It can be downloaded in Stata, SAS, SPSS, CSV, fixed width, and all of these files will come with automatically generated code books. This will be demonstrated in more detail during the web demonstration portion of the workshop. In our most recent count, we had 1.4 billion records available across 750 surveys and censuses in the microdata collections. Next, I'm going to demonstrate an example of what it means to integrate a variable. This process is similar or the same for all of the microdata projects. The goal of integration is to make codes and variable names for the same information consistent across time and place. So our job is to look at the data and the documentation to see if variables with different names on different surveys are actually conveying the same information. If so, we give them a common name that is a harmonized name so that they're easier to work with across time and place. In this process, we document our decisions and also add any additional issues a user might face when they're using integrated variables. Having thorough documentation is essential for understanding how to assess data comparability across time and place. For example, it's important to know the denominator of your variable's universe. For example, if you wanted to compare modern contraceptive use prevalence across time or between countries, it would be very important to know if one country asked that variable about contraceptive use to only married women or women in union, and a different country asked that variable or question to all women. Those two different estimations would not be comparable because they're measuring two different populations of women. This is an example of the type of information we document so that users can make informed decision about their analysis. So let's get started with an example. This is an example from IPUMS PMA, one of the global health projects that we'll talk about in more detail later. This is a question that reflects the woman's highest education level that the woman attended. Because education systems vary across countries, the categories reflect the country's levels of schooling, and they have different codes and different labels. For clarity and to help visualize, I'm going to put these into a table, and I'm going to add an extra column to represent the integrated variable. This next slide shows that the comparable categories are grouped in the same rows. I've also reordered these categories so that like categories are grouped next to each other. For example, university is a higher education level than post-primary vocational for this Kenya example. The labels here on the left side are the integrated values that you would download from our website. Next, I'm going to be adding codes that represent these comparable categories. Never attended and primary are coded the same and are comparable, so we will code these the same. You can see that this coding scheme has 3 digits. This is called composite coding, and the leftmost digit here represents the most general, and additional detail is contained in the digits further to the right. So in this example, the 100, the 1 in the hundreds category represents a broader category than the tens or the ones place. I will also make broad categories for secondary and tertiary. For example, we'll give secondary the digits of 4, 400s, and tertiary the first digit of 6, or the 600s. I'm skipping 5 because in other countries that aren't in this example, there are categories within the post-secondary vocational. However, to retain the detail, especially in the secondary and the tertiary categories, this is when we use the composite coding and the additional categories of detail. So in this example, cycle 1 and cycle 2 in Burkina Faso are kept separate from the A levels in Kenya, because these are not the same. But their codes indicate that they should be somewhat related, and they fall under the general category of schooling. So in this situation, we would use the second digit, the tens place, to indicate differences within the secondary category. If you are interested in analyzing broad categories, you could just collapse all of these codes into their first digit. And this would allow you to generally do analysis on the categories of never attended, primary, post-primary, secondary, and tertiary. However, as you can see, the integrated variables also retain all of the detailed information. So this allows you to make comparisons between women living in all of the countries, if that's what your analysis requires. The resulting integration process means that you can download one data set with women from each of the different surveys in one file. This is an example of how that data would look. The rows represent individual women from 3 different surveys. So Kenya, India, and Burkina Faso. Each row represents information on a single woman. The columns represent different variables. So these first columns represent which of those 3 surveys the woman is a part of, the India, Burkina Faso, or Kenya. And then different columns can also represent household characteristics, such as household identifiers, urban status, or individual woman characteristics, such as age. You can use, let me go back. You can use any statistical software to read in this data set and do your analysis. Like I mentioned, Stata, SPSS, SAS, or R. And I want to emphasize again that the projects we discussed today are not aggregate data. From our website, you're not downloading tables that are grouped into countries or regions, but you're downloading individual records with characteristics about either individuals, maybe individual women, individual households, individual men, or individual children. We have a dedicated user support team that can answer any questions on our website or any questions about the data. They can also direct your questions to any of the different projects to figure out how to best support your research. Now we'll take a little bit of time to answer any questions that have showed up in the Q&A. Devin, do we have any questions in the Q&A that we would want to address before moving on?
Nope, all set.
Excellent.
Oh, actually, we just had one come in.
Sure.
Does the person level information break down by region of country? That's kind of a general question. Do you want to take that?
Sure. Typically, yes, it depends on exactly the geographic level of detail, depending on the data collection. Perhaps it's a first level geography, perhaps a second level geography. We'll talk a lot more about geography sort of in the 3rd section, but the individuals would have that geography level attributed to them.
Okay, and 2 others came in. So one in particular is how can we manage data for households versus individual? And I do want to clarify, does Mix or DHS offer household records, or just it's always individuals?
I think we'll go into some more details because answering that question about individuals and households depends on the data collection. In some data collections, the individuals can be pre-linked. So you could download data on an individual woman and all of her household characteristics could be already linked to her. Another situation is there are some linking keys where you could download household level data and individual woman data and then link those on your own. It depends a little bit on the project, which strategy is possible.
Right, and then 2 more. The first of which is the composite variable ordinal? I think referring to the educational.
It depends on the variable. I don't think I can answer that question in any more detail. Typically, there is some sort of overarching theory behind the ordering, but it depends on the variable for sure.
And then one last one, and this person says, I guess when we get to geography, are these individual records geocoded to attach any environmental variables to them afterward? And I can answer that. Yes, we will be talking about it, and the answer is it depends on the data project. So in particular, DHS does this for you for certain types of variables, but then we'll get to that later when we talk about individual projects. Yeah, unless there's anything else you want to add to that one, Anna.
No, I think it certainly seems like our answers saying it depends on the data collection might lead us right into where we're going next, which is giving basic overviews and summaries of each of the different data collections. And if there's anything specifically, we can try to address it as we go. But I think that we'll switch to the next section of the talk. All right. I'm going to keep presenting for a little while longer because I am very excited to present on the newest of the IPUMS data collections, which is hopefully going to be launching later this month. And the IPUMS Mix project will be joining the other projects as part of the global health data collections. We had hoped to be demonstrating the IPUMS Mix collection today, but we're just finishing up some final quality assurance checks and working with our partners at UNICEF to make sure everything is ready to go public. It certainly looks like this could be happening any day, and we would be sending out an announcement with the follow-up materials that I mentioned we would be sending out after this workshop. You can also sign up for the IPUMS newsletters, and that announcement would be coming in the newsletter also. So currently, the IPUMS Mix project is not found on the web, unlike the other data collections that we'll talk about today. So what is IPUMS Mix? IPUMS Mix harmonizes and integrates data from the UNICEF Mix surveys. Mix stands for the Multiple Indicator Cluster Surveys, and these surveys were developed by UNICEF in the 1990s and conducted in partnership with countries around the world for the last 3 decades. The surveys share many similarities with the demographic and health surveys, or the DHS, as they target women and children to track progress on first the Millennium Development Goals and now the Sustainable Development Goals. However, there are several really neat, unique features of the IPUMS Mix surveys that I'm going to highlight today. UNICEF strives to produce comparable data across all the countries that they work with. However, the surveys have changed over the years, and different countries make changes to the survey in ways that better suit each country's needs. Like the other IPUMS projects, IPUMS Mix fully harmonizes and is a fully harmonized and integrated dissemination system of the UNICEF Mix data. UNICEF Mix has partnered with UNICEF to create a system that's easier for users to access and download the data. The dissemination system of Mix can make it easier for researchers who want to conduct analysis over time or between countries. As I mentioned, we're really close to being able to go public, and we'll make a big announcement later this month. In this first release of the project, IPUMS Mix will have 88 countries, over 200 samples, and 1,000 data sets across the different units of analysis. We will be releasing over 900 variables found in the standard Mix questionnaires. Our main focus is to provide data for all available countries when we first launch this project. We will continue to expand the collection of harmonized variables in subsequent releases. Here's a map of the coverage of the IPUMS Mix data. Many of the countries shown here have multiple surveys spaced approximately every 5 to 10 years apart. There's also a small number of countries that have statistically representative subnational samples, either a specific area of the country or underrepresented populations. Over time, there have been different rounds of the Mix surveys where there's either major or minor changes to the survey questionnaires. This is a similar concept to the phases in the demographic and health surveys. We will be releasing all samples from rounds 3, 4, 5, and 6 that are available at the time of the project launch. We aim to be releasing new data sets shortly after they become available. And we aim to eventually expand the data collection back in time to include round 2 as possible. As we're releasing all the countries at once, the area that we will continue to approve over time is the collection of harmonized variables. As I mentioned, there will be over 900 variables when the project goes live, and we hope to be releasing hundreds of new variables in the next few years. The data will include variables from all major units of analysis from the mixed standard questionnaires. So let's talk about what those look like. The style of the mixed questionnaires is similar to the demographic and health surveys. At its base is a household questionnaire. Included in the first data release will be information on the household rosters and all the members living in the household, household characteristics, water and sanitation, and a unique feature to the UNICEF mixed surveys is in some of the most recent samples, a test of water quality was conducted by field teams to measure E. coli in the household's drinking water. The primary focus of mix is women of reproductive ages, and women as a unit of analysis are included for all countries and all rounds. In addition to basic demographic information, the variables that will be available in IPUMS mix include reproductive health, maternal and newborn child health, fertility history, contraceptive, and unmet need. And for many countries, there's also a separate data set on a complete birth history for interviewed women. Many samples also include a questionnaire for all men who live in the household. Typically, these men are also the 15 to 49-year-olds, similar to the women. And the men and the women in the household share many common topics. In addition to basic demographics, some of these common variables across the men and the women include mass media and information technology use, sexual behavior, HIV, domestic violence attitudes, and life satisfaction. Next, all samples will have a questionnaire for children 0 to 4 years old, and this includes all children living in the household, even children who are not living with a biological mother. This is a pretty unique feature to mix. Variables about the children under 5 that will be included in IPUMS mix include demography, child functioning, early childhood education and development, anthropometric measures, child illness, and child discipline. And the final aspect that's very unique to mix, and I'm very excited about, is the inclusion of a survey specifically for children 5 to 17. This adolescent age group is often overlooked in global health surveys, and the mix data includes information on demography, literacy and numeracy, parental involvement in the child's education, child discipline, and child labor. The IPUMS mixed data collection will include all of these different units of analysis upon launch. We will be expanding the topics for all the units in subsequent data releases, and as we continue to harmonize more variables found in the model questionnaires and also the country-specific questionnaires. If there's a specific variable or module that's of interest to you and you don't see it in the IPUMS mix data collection once it's released, please reach out to us. Like I said, mix is coming soon. We're very excited about this, and hopefully we'll be able to make an announcement later this month. I will pass this over to Dr. Miriam King to describe another of the global health projects that IPUMS DHS. And while we transition, we can take some more questions.
Oh, yes, actually, there were two that I thought this might be a good point in time to address. One, for example, is it possible to use these data to create a variable on family structure? And I was going to type in the answer that yes, there are household member records, I believe, for all 3 global health and definitely for the International Census Project, where you could categorize households, but I did want to make sure that was correct for mix.
Yep.
Great. Okay. So yes, that's it is possible. And then There was a question about disability just before you brought up on your screen that there are disability, but I did want to quickly ask Miriam, are there disability questions in the DHS?
Yes, not every survey includes them, but a number of surveys include a module, not necessarily very standard, on different types of disability, usually for members of the household. So, does any member of this household have difficulty seeing, even with glasses? Who is that? Yes. So it is possible to, for many surveys, though not all, to identify household members who are have some sort of disability.
Great. And then there's another one where, that I can answer by typing.
All right. Thank you, Deb.
Mhm.
Okay, and so I'm Miriam King. I'm going to be talking about IPUMS DHS. Thank you for supplying such a great opening for this, Anna. You covered so many things that people need to know that you've made my job really easy. So IPUMS DHS's URL is here, or you can get to it through the general ipums.org website. And I want my screen to move. Oh, shoot. Oops, okay. All right. So I know from having exhibited at CUGH as a conference before that lots of people who attend and are affiliated with CUGH are familiar with and work with demographic and health surveys. But I want to make sure we're all on the same page by giving a little bit of background to what is the DHS for someone for whom this might be new. So the demographic and health surveys have been fielded from the 1980s up through the present. Data is being collected even as we speak. And the goal of the demographic and health surveys, which are funded by USAID and managed by the DHS program, is to collect and disseminate accurate and representative data on population health, HIV, and nutrition. And the term health there is really very broad in terms of what it covers in the DHS. There's data on child vaccinations, acute illness in children, infant and maternal health, disability, intimate partner violence, fistula, alcohol and tobacco use, chronic illnesses, all sorts of health topics. And to date, the DHS covers over 400 surveys in more than 90 countries. Now, those surveys are of different types. Some of them are collecting information on organizations or institutions that provide health care. Some of them are to monitor malaria incidents or HIV and AIDS. And the most commonly used and most familiar to most people are the standard DHS surveys that are cover a really wide range of topics. And IPUMS DHS is currently just focusing on those basic standard DHS surveys or slight variations on them, like interim surveys that are a little shorter, but basically modeled on the standard DHS form. We're not doing the malaria, AIDS, or health service provider surveys yet. And DHS has been a leading source of information on health for women, children, men, in terms of household members, people of all ages in low and middle income countries for decades. Oops. Okay, so what is IPUMS DHS? IPUMS, as Anna has introduced very well, is a website, a tool to browse variables and learn about the data and create your own custom data set that fits your research needs. To access the data, well, to use the website, you just go to the URL and look around. If you want to download data to analyze it on your computer, you have to register with the DHS program, because the DHS program is the legal owner of the data, and therefore they legally control access to the data, but they want them to be used for teaching and policy making and bona fide research. So yeah, you have to fill out a form, but it's not hard, and they want to give you access. If you are already registered to use DHS data, you can log in to the IPUMS DHS website with your username and password from the DHS program and start downloading data right away. If you have not registered, you need to register with the DHS program, and I'll show you how to do that on the IPUMS DHS website a little later in this. IPUMS DHS is especially useful for studying change over time or conducting comparative research across multiple settings, multiple countries. Our source material is drawn from the DHS public use files, but we recode the data to make it consistent across time and place. So the values, that the codes that you might see in the original DHS public use files are often different in IPUMS DHS, because we have to encompass the full range of samples, not just one sample at a time, but have codes that will take into consideration and encompass all the samples that come into our purview. So there's by no means a one-to-one match between what's in the original DHS files in terms of codes and what's in IPUMS DHS, but the source material is the same. We provide extensive variable-specific documentation, as I'll be showing you in the website tour, and we have over 1,500 integrated variables currently available through IPUMS DHS. Whoops, I keep going in the wrong direction. So the scope of IPUMS DHS is currently 180 samples from 45 countries. We were initially funded to focus on Africa and South Asia. And we currently cover most of the sub-Saharan African countries, North African countries, and Middle Eastern countries, and South Asian countries in IPUMS. Are in DHS. By the end of this summer, we expect to have included all of the currently publicly available standard surveys for those areas, and then start moving on to other regions such as Latin America, Eastern Europe, Oceania, and East Asia. And of course, as new data are released, adding those in as well. So some of you who have worked with the DHS know that there are what are called standard variables in the DHS to try to help people do analysis across settings or over time. So I have been asked, understandably, well, why bother to use IPUMS DHS? My response is that if you're just looking at one sample and that's all you want to look at, I think it's pretty straightforward to work with the original DHS public use files, but it gets a lot more complicated if you're working with more than one survey. And there are a number of value addeds in working with IPUMS DHS. First of all, our website makes it very easy to identify the topics and the variables in each sample. It's way easier to look on the web and look at a user-friendly interface than it is to leaf through hundreds or thousands of pages of code books and surveys. IPUMS DHS gives consistent variable names and codes to non-standard variables. So actually, a majority of variables that come up in the DHS public use files do not have standard names, are not standard. And many of these so-called standard variables only are standard in the sense of the name of the variable is standard, but the responses vary across countries. So there's a lot of variation under the hood that you have to either make inadvertent mistakes with or recode yourself if you work with the original DHS files, but we take care of that for you in IPUMS DHS. We provide additional documentation not otherwise available from the DHS program on each variable's universe, that is who answered the question. The question wording, always in English. We translate material from Arabic, Spanish, French, and Portuguese to put it up on the website in English. We do linkage between various file types, so you don't have to. So, for example, we link the mother's file to her births and her children's files. The original public use files do that to some extent, but they leave out the country-specific variables and some modules. And so you can get all of the mother's variables linked to a child or a birth using IPUMS DHS. And we link the household record to every other file type. So all of our records in IPUMS DHS are for individuals, but the household variables are there so that you can think of, for example, type of toilet facility. Perhaps you want to know if that's associated with whether or not a child under 5 recently had diarrhea. You don't have to link between the household file that has that information and the child record. We've done that for you. So it is records for individuals. If you want to do household level analysis, you can work with the household members file and just select the household head or person number 1 in the household to do household level statistics. But I'm working on a blog post on that to help people sort of sort that out. But basically, it's data that is on individuals with their household characteristics as part of their characteristics. There's almost an embarrassment of riches in the data in the DHS files, thousands of variables in every data set. And IPUMS DHS allows you to create a very manageable data file with just the samples and just the variables you need for your research project. And you don't have to ignore lots of variables that aren't relevant to you. There are also some value-added things in IPUMS DHS. Someone was asking about the GPS points and contextual variables. We have created, my colleague Sheila Sarker, who's going to be speaking soon, has created contextual variables on topics related to the physical environment, the climate, economic and social characteristics, and agricultural characteristics. And that is done by using the GPS sample cluster points, which are to respect respondent confidentiality, are displaced within a 5 to 10 kilometer radius. So taking that displacement into account, we draw a 5 to 10 kilometer buffer zone around sample points using ArcGIS. We bring in non-DHS information that is indexed by geographic location and match it and associate that non-DHS information with all survey members in a sample cluster. So we do not distribute the GPS data ourselves. You need to get that from the DHS program, but you can create your own contextual variables and attach it to a sample from IPUMS DHS if you're so inclined and so skilled, or you can make use of the contextual variables that we've created for you. For more information about the contextual variables in IPUMS DHS, I would direct you to an article by my colleague Elizabeth Boyle, myself, and others on contextual data in IPUMS DHS in Population and Environment, May 2020. Another advantage of using IPUMS DHS data compared to the original DHS data is it's way easier to do the reproductive calendar data in IPUMS DHS. These rarely used but very rich data were collected by asking women of childbearing age about the timing or date of their pregnancies, births, pregnancy terminations, and use of specific contraceptive methods in the 5-year period before interview. Not every sample includes this, but many do. But they're very underutilized data because they're so difficult to use in their original form. They appear as string variables. You have to destring, you have to recode them. If you're working with more than one data set, a lot of the responses are given alphabetic codes rather than numeric codes, which computer programs do not like doing. And so we've tried to make it much easier, making the data consistent, easier to use, variables for the reproductive calendar to study topics like contraceptive failure rates, length of use, reasons for stopping a contraceptive method, premature births, relationship between intimate partner violence and miscarriage, prevalence and timing of abortion, and so on. So we're hoping, having made the data easier to use, these are going to be more widely used in future. We have an article that just went online. Elizabeth Boyle, Nir Rotem, and I on how to use the reproductive calendar data in IPUMS DHS in studies and family planning that was just posted in March of this year. So those are some of the advantages of using IPUMS DHS, and I'm gonna pass the baton on to my colleague Devin Christensen, although if there are any questions that I can answer at this point, I'm happy to do so.
The only question that just came up, could you send those links in the chat? Perhaps, I'm not entirely sure which links, but perhaps links to the papers you mentioned is my guess. I don't know if you wouldn't mind sending those links, or
okay, I'll try to do that.
yeah, or maybe that person can clarify what links that they're looking for, but we're happy to share links to anything.
We will definitely also, once this is over and once we're able to post the webinar, we also post a transcript of the Q&A, and I can also include the DOIs in that.
Oh, great idea. All right. Thanks, Miriam. So I am Devin Christensen. I am the project manager for IPUMS PMA. Okay, great. The IPUMS PMA is the harmonized version of a survey series called Performance Monitoring for Action. Performance Monitoring for Action is a high-frequency recent survey series on family planning, sexual and reproductive health that's fielded its first survey in 2013. There are currently 9 countries in Africa and Asia where they are being conducted. It was initially 11, and the goal of Performance Monitoring for Action, when it was established, was to monitor progress towards FP 2020 goals. So rather than having monitoring progress by DHS samples, because they're about 5 years apart, these would be at least annual surveys, and sometimes they fielded surveys every 6 months or so. They use mobile devices and women who live within the primary sampling units to be interviewers. So it's a rapid turnaround survey. So both PMA and IPUMS PMA are funded by the Bill and Melinda Gates Foundation. We currently have more than 200 samples, more than 9,000 variables, and more than 2 million records in IPUMS PMA. So as you can see, the focus is in sub-Saharan Africa and then India and Indonesia. Unfortunately, Ghana and Indonesia are no longer participating, but the other countries are. So the PMA sampling design is very, very similar to the way that DHS is collected. So it's a multi-stage stratified cluster sampling. So in each country, they work with the Census, the Statistics Bureau. They stratify and then they sample in what they call enumeration areas from each strata, and then they randomly select households from those enumeration areas. Then they conduct a household survey, just getting a roster and some other basic information about the household. And then the interviewer returns to conduct a survey of all women from age 15 to 49 within those households. And PMA produces normalized survey weights for these surveys. So as you'll see later, with very similar to both MICS and DHS, when you come to the IPUMS website and you go to start browsing through the data with PMA and all the global health surveys, you'll be prompted to choose a unit of analysis. So PMA is its rapid turnaround. They're innovative. They're constantly evolving their surveys. They fielded data in both to household and women, but also to health facilities. So that's the service delivery point data that you see there. So they might go out to a hospital, but they also have surveys that they've fielded on nutrition, a COVID-19 phone survey, maternal newborn health, and I'll talk about each of these in just a moment. So a little bit more detail on the household and female surveys. So originally it was only a cross-sectional survey, but with a redesign that was begun in 2019, they're conducting longitudinal panels for the female and household. But they've also added some, they sample additional households to adjust for attrition and other factors, so they maintain the ability to continue calculating indicators as a cross-sectional basis through the period that's still longitudinal. So some of the questions that you might see from the household record is their possessions, their water sources, sanitation facilities, and then the core female questions center on fertility, family planning, and reproductive health. And a lot of those are comparable to DHS questions. But like I said, PMA is an ever-evolving survey, and they are very responsive to their in-country partners and interests that their in-country partners want to add. So some examples of topic modules that they've added at some countries and sometimes detailed migration questions, health insurance, gender-based violence, abortion experiences, economic and women's empowerment, menstrual hygiene, their questions on contraceptive side effects, and then also they do have a contraceptive calendar, but it is not yet processed in a way that IPUMS DHS has. We hope to do that in the future. And then for the service delivery point data, these are similar to the SPA data that some of you may know from DHS, but the main difference here is that they survey in the same enumeration areas as the surveyed households. So you can connect the service context of these facilities to individual women and households because they were fielded in around the same time, maybe just a few months difference. So what PMA does is they sample up to 3 public and 3 private facilities within a small area. And again, these areas contain about 200 households or so. So they were talking about small areas. So then they ask questions of a knowledgeable respondent within this hospital, this clinic, maybe a pharmacy. They ask questions about, do you usually provide condoms? Do you usually provide them for free? And they might ask about stockouts in the last 3 months or other health services that these facilities may provide, including antenatal care, abortion, post-abortion care, postnatal, and maybe some types of delivery, and then medicines that they may have. A lot of rich information in these files. And then one kind of oddly fortuitous timing for the fielding of the longitudinal panel data is that in 4 countries, Burkina Faso, the DRC, Kenya, and Nigeria, they fielded the very first baseline survey in late 2019. And then with the onset of COVID-19 restrictions, they quickly pivoted and they fielded a phone survey that can be linked with the longitudinal panel on how COVID-19 restrictions was affecting women's access to healthcare, in particular for family planning. But they also collected some information about where women were getting their information about COVID-19, the information sources they trusted, and also asking what sort of social distancing measures they were taking. And a different type of panel data that PMA has is in Ethiopia. So there have been 2 cohorts that have been released thus far. They do some sampling to find pregnant women, and then they follow up with her several times, up to about a year. They ask questions on the antenatal care that they had before their delivery. They ask questions on her pregnancy or delivery complications, whether the infant has health issues like a cough or anything like that, and also whether they sought treatment for these issues for their infant. They also ask questions about vaccination. Another really innovative thing that they've done in the last few years are client exit interviews. And so what this means is they're going to service delivery points that they have interviewed as a part of as the facility unit of analysis. But then they find women who are exiting the facility on a particular day. And if that woman received either family planning information or a method as a part of her visit, she has a short interview about her experience, about her method preference, what she perceived to be the quality of care she received, and whether she's satisfied with what she received. And then you can also, see maybe the staffing or other questions from the service delivery point information and link that to see if that has some sort of effect on how satisfied the woman was with her experience there. And lastly, PMA did get some funding to do some nutrition surveys in Burkina Faso and Kenya. So this was a household and female survey combined with facilities. So and they asked questions in the facility survey about types of food programs that they might support. They focused a lot on children under 5, their diet, biomarkers like the upper arm circumference, but they asked questions about household food security, diet, and breastfeeding questions as well. And another component of the grant with IPUMS PMA is that we have a blog that my colleague Matt Gunther leads. So he posts about every other week, and we demonstrate a lot of different approaches to using the IPUMS PMA data, and shows the code. He mostly codes in R, but it shows you step by step how you might undertake an analysis. He advertises new data that's gone up, or he might try to replicate a published paper using IPUMS PMA data. It's an excellent resource, and he is fantastic with data visualizations in particular. He does a lot with mapping. This is some work from one of our postdocs on using ACLID data. So PMA also has displaced GPS points for its primary sampling units, those EAs. But again, we at IPUMS cannot disseminate those displaced GPS points. You have to go to PMA. But this is an example of an analysis done with those and on our blog. And lastly, we have also been doing a little bit more work demonstrating how one might use these new longitudinal panel data to produce analyses through the blogs. This is an alluvial plot to show how people move from either not using family planning, pregnant, or using family planning between the 2 phases. So with that, I will pause to see if there's any questions that I might be able to answer right now.
Devin, you do have a question here. On service delivery PMA dataset, did you collect information on use of intermittent preventive treatment for malaria during antenatal services?
Okay. So one thing I do want to clarify for everyone is that IPUMS does not collect data ourselves. We take data that's collected by other organizations and harmonize it. So there were not any questions that I can think of about malarial intervention. The closest thing I can think of is that in the Ethiopia maternal and newborn health panel, they do ask whether the mother slept under an insecticide treated net during her pregnancy. I think that might be the closest that I can think of regarding malaria. But that's a great question.
There is another question which spans all the projects. Is IPUMS PMA DHS, does it collect data at similar countries in similar periods? I'm going to address a little bit on that when I do geography, but no, there is overlap, but no, they don't collect data. It depends on the survey and the project. So if anyone else wants to add anything on that, you're welcome to.
There is some overlap of countries, but I think go ahead, Mira.
Yeah, the IPUMS PMA and IPUMS DHS have some overlap in content, but they're less alike than IPUM than DHS and MIX, I think. If data were collected, close to a time of a DHS survey by PMA, I think it wouldn't just be sort of replicating it. I think it would be like different and additional information. And also DHS surveys happen at, except for a few countries that do them every year, happen at fairly long intervals, like 5 to 10 years apart. So there isn't really too much worry about like, oh, are they just duplicating each other? For IPUMS MIX and IPUMS DHS, sometimes a country does a survey that counts as both a DHS and a MIX survey, and in that case, it's distributed through UNICEF's MIX site. If that is not the case, it would be extremely unlikely that, somehow like DHS and MIX were both going into the field and kind of replicating each other's work. They're very aware of what the other survey is doing, and basically it extends the scope in terms of global reach and the time series for if you look at what's in IPUMS DHS and IPUMS MIX, but unless it's a kind of joint survey, they don't tend to be at the same time. You get more years and more countries if you look at the two across each other. Anna, do you want to speak to that a little bit too?
Yeah, I will be talking about this a little bit more in detail, the direct similarities between the 3 global health projects, and a few cautions about major differences across the 3 projects. I'll be talking about this a little later on in the discussion. So if there's still questions after that portion of the presentation, we can come back to this at the last Q&A.
Devin, there are 2 more questions for you. I'll combine that together. What's your target timing of releasing the data on IPUMS after it has been released by PMA, given the number and high frequency of the surveys? And also, I'm going to tie this one with that. When will you release the data set of the second panel data set collected for Ethiopia?
Oh, perfect. Okay, well, I've got great news about the Ethiopia one. Our second cohort is already on our website. So that's the one that spanned from 2019 to 2021. So that was released, I believe, in December. So go ahead and enjoy that data. But regarding the first part of that question of, so a little peek behind the scenes of our metadata architecture, it is much easier for us to add surveys in the same unit of analysis And we establish our deadline, our deliverables like 3 years ahead of time. So PMA releases data by country, and they will release the longitudinal family planning one. They will release the service delivery points and maybe client exit interviews by country. So we wait to try to capture as many of those countries as we can with the release. So it may seem like we're really sitting on things for a long time. That's because we're processing all of the the unit of analysis together. So we will be releasing data at the end of this month, and that will be our first wave of phase 3 longitudinal panel for Burkina Faso, DRC, Kenya, and Nigeria, and then we'll be releasing phase 2 data of the longitudinal panel for Uganda, India, Cote d'Ivoire, and Niger. So those data are very soon to come up, but we do try to go as fast as we can, but there's also things that come up with when PMA releases the data. So.
There is one other question that I don't know if it falls within your knowledge province, but do you know why the number of countries has gone down a bit since the opening? Why Ghana and Indonesia are no longer participating, or is that internal negotiations between those countries and Gates Foundation that the people doing the data work in the weeds do not know?
Yes, it would be the latter. I think that is it's conversations, particularly for Indonesia and Ghana, it's conversations between the in-country partners and PMA and Gates. So and we are not at all privy to it, but the one thing that PMA really does well is they work very closely with in-country partners at a university in-country, and their in-country data teams lead a lot of the efforts to do the first round of data processing and deciding what's on their survey. It could have been any number of reasons, just lack of interest, funding, who knows. But yeah, I'm disappointed to have the countries leave. So
I think I can pick up IPUMS International. We are running a tiny bit late, but that's great. There are so many interactive questions, and we love talking to you all when we are presenting, because it's like, okay. So I am going to talk about IPUMS International that releases the census and the survey data sets, microdata again. So I'm Shula Sarkar. I work as a senior research scientist for the IPUMS International project mostly, but I am also a geographer by training. So I do geography, GIS for all the projects that we have been talking about today. So I'll talk a little bit about what the census data is and how it can be used along with all the projects that we have been talking about, and also a little later about some GIS and geography. So IPUMS International, this is our landing website. It is the mission of the project is to collecting and distributing international census microdata from around the globe. Right now we have data on 103 countries and 547 censuses and surveys, and over 1 billion person records. Our data set wouldn't have been possible, the whole project, without the generous participation by the National Statistical Offices, who have kindly entrusted their data to us. So here is a picture from our mission, which is data collection and preservation. Here is an example from Bangladesh, where there were moldy tapes, and IPUMS went in and cleaned up, like trained the people in cleaning up these moldy tapes so that the data could be recovered and used by the users. Here is another example from Sudan, where the tapes got dirty because of the sand coming in from here. And again, IPUMS helped in the recovery mission. So some of the features of IPUMS International are not very different from what you have heard from my colleagues. They are microdata, anonymized, they are harmonized. Anna talked a little bit about them. We'll talk a little more about geography later, and the data are free. So nothing different here. In blue, other countries where we are distributing any data on census or survey data. Light blue are some of the countries where we distribute historical samples from. And then green means we have a memorandum of understanding with these countries, but we have not yet acquired the data, or the data is there, but we are working on it and has not been distributed yet on our website. The latest release had some of the data sets that we listed here. So not only you have data from 103 countries, but you have several samples from countries. So Indonesia provides us with 9 samples. So it's colored darker in color. So as you can see, multiple data sets. And my colleague, Dr. King said, like, these data are fabulous for time series analysis. There was a question on pointer variables like family interrelationships and interrelationship variables. So I cobbled this slide up together to show that IPUMS, all the projects, they create pointer variables where you can locate the person's mother, father, or spouse if one is present in the household. The census data sets do that, but some of the other data sets will also have pointer variables. I'm not going to go into a lot of detail on this visual, but here is person number, you have their relationships. You can say who is the spouse by the spouse's location. You can also do mother's location and father's location. So a lot of this calculation is done for you. So one of the value added things of IPUMS. So if you download the data, you automatically can download these variables for your analysis as well. Here are some of the commonly requested variables from the census and survey data sets. Basic demographic characters, employment and industry, education variables, income and dwelling characteristics, birthplace, then household size, age of eldest child, and then some of the pointer variables that I was talking about. So why we are in a health conference and we are talking about health data. So why am I talking about census data? You're wondering. But census data, it's like the number of persons in the census data is huge. Like, so your sampling frame is much greater than some of the surveys that we talked about. So one of the ways people are using census data is to use census data in conjunction with the other data. You have LFS data, people use raster data along with census data. So here are some publications, an example where people are working on climate data along with migration data from the census. Here there is data on cell phone coverage along with census data. So the opportunities are endless. So here is another question we had about countries and if they have similar countries in each of these data collections. So this is IPUMS International, the Census and Survey Project, and then this is DHS. So you can see we have common countries that are there both in the census and in the DHS. So you can use census data along with the DHS data to answer some of your research questions. Here is PMA and mix. So there are a lot of common countries. We haven't talked about these two projects, but I'm just going to throw this out there. This is an aggregate data project via IPUMS, that's the IHGIS. They are fairly new and they have a few countries. And IPUMS also has a project on time diaries, which also has data on some international data. So based on all the similarities in countries that I showed, we can connect these data sets by geography. Disaggregation by geography is one of the common things that people do. So this is the first administrative level of geography that is available in the census and in the IPUMS data sets. So how could you use that? Here you have DHS, which has 5 units, and you have IPUMS International, the census project, which has 7 units. So you can do crosswalk codes, like make sure that their geographies are similar. So these two are combined because Sylhet was created from Chittagong in 98 and Rangpur was created from Rajshahi. So we have combined these two. So we have a common code, and here we are linking both the projects. These crosswalk codes are available in the DHS project and in the IPUMS International project. You can also crosswalk to the MIX project. So here we get into this bigger question of data interoperability, where you can disaggregate by geography and connect each of these projects to one another, and then get variables like education, migration to work with your health variables. GIS files are also available at the second administrative level of geography, and you can see the number of units increase significantly. One way to work on that would be crosswalk with the GPS clusters that we were talking about. Here is an example from DHS. So you overlay the IPUMS International Census boundaries on the DHS boundaries. The yellow circles are rural areas, which are displaced at 5 kilometer radius. The green circles are urban areas displaced at 2 kilometer radius. So for all these units, you can safely say they are located in this admin area. So we provide the DHS ID, an IPUMS International code, and a placement probability where you can use the cutoff. If there are units which are like this, you can discard it from your analysis or say that the probability of this GPS cluster being in this unit is higher, so I'm going to take it. So you can use any probability index and use it as a cutoff to use or not use that point of cluster. But I guess you get my point. You are connecting 2 projects here and getting a huge amount of data from the census to connect with your PMA or DHS variable. So here is a visual that says at the first administrative level of geography, you can connect all these projects together if they have data on the similar country. At the second admin level of geography, you can do some DHS, not PMA, but you can connect them by the GPS clusters. I threw in the IHGIS project in here. And at lower levels of geography, you can do some of the mixed countries, very significant, I shouldn't say significant, a very few number of mixed countries have geographies which are very low level, and you can connect these together for your analysis. Here are some examples how you can use census and surveys. Surveys have rich detail, and then you can also do small area estimation with the census. So here is an example of adults 60 plus who reported any kind of cognitive disability in Vietnam. And here a census and a survey are combined together. It's the same survey, but some of the advantages of using census data, you can disaggregate by small population groups, and then you can do like age 60 plus. or people with severe cognitive difficulty. Some of the other ways that you can use census data and health data are to work on the Sustainable Development Goals. We have 36 indicators that we can measure and several goals. Here is some example on COVID research. That we can do. And this is where I'm going to end my section here. But if there are any questions, I am happy to take them right now before we go for a break.
There's just one, and I don't mean to put you on the spot if in case you're not close to the data processing right now, but someone asked about the possibility of releasing the Indonesian population census 2020. And is that being worked on by IPUMS International?
Yes, so we are working on corresponding with Indonesia. We recently met them at one of the conferences, and we are emailing them, but we haven't received the census data as of right now.
Wonderful. That's it for now.
I just wanted to make one kind of amendment to a point made by Shula. The family pointer variables are a wonderful feature in IPUMS International, and they are also in many other IPUMS microdata projects, but they really depend on the data being released with basically everybody in one file arranged in households. In DHS, MIX, and PMA, if you've worked with any of them, you know that there are separate files for different types of people. There's the women's file, there's the men's file, there's the child file, there's, you know, the birth file, etc. So the only time that you really see everybody grouped together in IPUMS DHS is when you're looking at household members, which have less rich data on people than you know, the separate women's file, for example. So there are some summary variables. There is data regardless of unit of analysis of relationship to household head, but we're not able to do those terrific pointers that make it so easy to take into account family structure and family relationships when doing research with IPUMS International or IPUMS USA or IPUMS CPS or some of the other microdata projects for the US.
All right, thank you, Miriam. Thank you, Shula and Devin too. Let's take a 5-minute break. If any questions come in during the break, we will make sure to answer them. But know that if you do take a break for the next 5 minutes, you won't be missing anything, and we'll make sure that we address the questions when everybody gets back. So it is 2:22 Eastern time. So at 2:26-ish, we'll come back together. All right, why don't we get started? I hope everyone had a chance to grab some water or stretch out your legs a little bit. This next portion, Dr. Miriam King will be doing a demonstration of the IPUMS DHS website to show the process of selecting variables and samples and creating a customized extract. Miriam, whenever you are ready. We will definitely be sharing the video, the presentation materials, and also pointing you towards multiple resources on the websites themselves that you can access at any time. If you have any questions about IPUMS at all, after you've looked at the websites, you can always email user support. So yes, we will be following up with links, materials, the video recording for you to access just as soon as this is over and when we have everything straightened out with CUGH and getting the video link all ready to go. So yes, we will be sharing materials and we are always available to answer questions after the fact too. All right, Miriam.
Okay, so we are on the IPUMS DHS website now. And I am going to be demonstrating the IPUMS DHS website, but I'm really demonstrating how IPUMS microdata websites work. If you learn how to use one, you can very easily move on to another because they are organized similarly, operate very similarly, and so this is applies to other IPUMS projects as well. So I'm going to start with these big purple buttons in the middle of the home page. What most people want to do when they come to our websites is see what data are available and make a customized data file that they can download and analyze. So if you want to explore the samples available, the variables available, learn about the data in depth, you come here and click on Get Data. The other two buttons, the online tool for data analysis, the online tabulator, Shula is going to be demonstrating that a little later in this presentation. And to create an account is basically going back to the fact that the data are legally controlled by and access is given by the DHS program, not by IPUMS for DHS. So if you want to access the data and you don't have a DHS account, you can click here. This brings you to a link that brings you to the form that you fill out to request to use DHS data and get their data archivist will review your request and get back to you fairly quickly, and then you will have a username and your email and a password that you can use to log into IPUMS DHS. And again, if you're already registered for DHS data, you're golden. You can just use that to log in to IPUMS DHS. I'm currently logged in, but you see this link up the top to log in and out would be where you would log in with your DHS user password. Okay, so let's hit the big purple button and look at getting data. Now I've already been on this website today, so it takes me to women as where it knew I was playing around earlier, but I'm gonna just show you how if you were new to the website, it would show you first that you have to choose the unit of analysis that you want to analyze. Most commonly, people work with data for women of childbearing age, but they may want to analyze data on the women's children under age 5, under women's all the women's births, the data on all household members, which has some data on the individual household members, education, demographics, marital status, and so on. but it has a lot of data on the household, like water supply and toilet type, that we attach to other units of analysis. Or you could look at data for non-elderly men, or if you're using the reproductive calendar data, choose women months, where every observation is 1 month of a woman's time during the survey or the 5 years before the survey. But most people are going to go with women for many analyses. Okay, so if you know what you want to, I mean, you can just play around and see what seems like would be fun to or interesting to do research on, but you may come to the website with an idea of a particular topic you want to study, or a particular country or time period you want to study. And you can access, get into looking at what data are available through either of those routes. If you want to use see what data are available on topics, we have this drop down menu. It goes on past my screen. I'm working with just a laptop here, so we can't see them all. But if I go, for example, to household characteristics or demographics, under this big category, there's core demographics, ethnicity, religion, marriage, cohabitation, fertility, child rearing attitudes. It's very wide ranging survey. And I'm going to, as the first example, go to the ethnicity and religion group and look at the religion variable and look at this particular group of variables. So what are you seeing here? You're seeing on the left-hand side the mnemonic name that IPUMS DHS has given the variable. If you've used for DHS data before, you know that they tend to use labels like V130. I have an easier time remembering religion, but you can display either the DHS, IPUMS DHS variable names, or the original variable names on the website. When you make a data extract, you'll only see the IPUMS DHS mnemonic. So there's the variable name, there's the label for the variable. If there is an X, that means it is in that sample. If there's a dot, it means it's not. So most, but not all surveys with data on women include information about religion. To the left, there's purple circles. If you think you want to include that variable in your data file, you would click on that, turning it into a check mark. And I can go right ahead and do that because I've already logged in. And you can see maybe that, and you can see here that the samples are shown in green. That means I have permission to download data for those samples. If they were in purple, when you logged in, that would mean, oh, you don't have permission from the DHS program yet to download the data, but you can go revisit the DHS program website and request the samples that interest you that you don't have access to yet. So let's look and see what we've got under religion here. So first part of the documentation is the codes and frequencies. And this is an example of a standard variable. It's got a standard name, V130, but the content is by no means standardized. You can see that, well, some samples, some values like Muslim, for example, are included in nearly every sample. Others like Pentecostal or Universal or whatever are only available for some samples. So as Anna very ably demonstrated before, we use this composite coding system where the first digit is consistent across all samples. So every religion that fell under the rubric of Christian would have a first code of 2. If it was a variety of Protestant, it would have a second digit of 3. And then specific Protestant denominations like Lutheran, we go to the trailing digits here. Lutheran is 2310. So that's a nice example of how even if a variable is supposedly standard in the original public use files of the DHS, the content is often non-standard, and even looking within a country over time, there is very little consistency in how the religion variables included, but we take care of that by giving you harmonized data. You can also get this in terms of case counts. These are unweighted numbers, so you should, in your final analysis, include the weights, but it does show you the size of some groups. Maybe you can see that some have pretty small numbers, and that might suggest, oh, maybe I would want to combine some categories here if the numbers are small. There is then a description of the meaning of the variable. And here it's just a quick summary. There's more detail under comparability where we raise possible problematic issues or explain things like the composite coding. So here you see the big categories we have for the first digit codes for the composite coding. There's also information on when this appeared in the DHS surveys in terms of their different 5-year phases, and religion has been asked since the beginning of the DHS surveys. And there's also for countries where there's a particular issue that you should be aware of, such as India here. It notes that in 2 surveys from the 90s, the Indian surveys asked the religion of the head of the household rather than the woman herself, and we've made kind of a leap of faith here that it's the same for the head of household and the woman. The universe tab tells you who answered the question. Now, there is not a filter question that's asked before the religion question's asked. So what we really see here in terms of the range of responses is that there are different sampling frames for the surveys themselves. So some include all women, kind of the modal category would be all women aged 15 to 49. Some surveys start with younger women, such as those from Bangladesh. Some have only ever married women. So let's see if I can find an example of that. So Egypt, for example, always surveys ever married women. So if you're combining samples with different universes, you may need to drill down and drop cases to get to a common denominator, like the example Anna gave of you don't want to combine only ever married women with all women in terms of contraceptive use. Another nice feature is we have an army of undergraduates who type up these survey forms and put in tags so that you can see what is the question that goes with this. And just looking down this, you can see that there are very different responses that were recognized on the survey forms for different countries. But you can check if you're interested in a variable, check for the samples you're interested in and see if there are subtle differences or major differences in wording that you need to watch out for. And you can also jump in to the full document of the survey and see what questions were asked before and what questions were asked afterward. Which can have some survey research suggests that may have some influence on how women or people are likely to respond. So that kind of tells you the way that you get information about individual variables. Now, the question that I'm going to use in terms of making a little data extract for demo purposes is we're going to ask whether women's decision-making varies across samples. So I'm going to go back to select data here. And I'm going to pull up a different set of variables on household decision-making, which is about who makes the decisions. Is it the woman? Is it the man? Do they do it jointly? Is it someone else? And here again, we can see that there's a lot of variation in terms of what variables are included in what samples. And this would be a nightmare if you wanted to look at this for multiple samples to go through code books and try to figure this out. So you can see it at a glance in IPUMS DHS. We can also, I want to show you another feature where you can either display the original variable names from DHS or the IPUMS mnemonics. So I'm going to switch to that, and it's going to make me repeat some of my work here, but very quickly we can go back to decision making. And now you see that, for example, whether the woman has final say on making large household purchases is a standard variable with the name V43B, V743B. However, a number of these variables are coming up with just the mnemonic, and that means there is no standard name for that variable on whether the woman can decide the use of her own earnings and so on. So if it's just the mnemonic, it means it's a non-standard variable that we have harmonized but won't be harmonized in the original DHS files. And if you just look at the frequency with which you see mnemonics, a majority of the variables on this topic are non-standard, and in fact, a majority of variables in the DHS program public use files are non-standard. So if you just work with the standard variables in the original public use files, you are limiting yourself from an awful lot of material that is actually collected by the DHS. Okay, so let's look a little bit at this first variable again on large household purchases. And here again, we see a case of composite coding. One or two samples asked not just someone else other than woman and partner made the decision, but provided more detail about a senior male, other senior male, other senior female. So to incorporate that detail, we needed to make it a 2-digit variable and apply that across all samples. Okay, now since I'm interested in looking at household decision making, and there's so much variation here with so many samples, I'm going to narrow it down and choose just a few samples. So we're going to look at this question for the most recent sample for India. We're currently working on making the India 2019 sample available, and it should be released this summer. Jordan's 2017 sample, South Africa's 2016 sample, and okay, so got Jordan, and let's put in a fourth one. Let's put in Nigeria too. Okay, so I've said I'm interested in these 4 samples. I click on Submit Sample Selection, and now I only see the variable availability and documentation for the samples I'm interested in. We don't want to overwhelm you with information that isn't useful to you. So we only, if you select a subset of samples, you'll only see information about those samples. And if there's a comparability discussion that's country specific, it will only show up for the samples you choose to display. Now, if we look here, we see that there are 5 samples, the ones with standard names, that appear in all 4 of the countries and samples of interest, but there are 3 that are only available for 1 sample. Well, that's not very useful for us. So we're only going to add to our data extract, our data customized data file, the 5 variables that are available for all the samples of interest. So if we look at our data cart, we can see what I've already chosen to be in my customized data file. 5 variables that were in all 4 samples and 4 samples. So our data cart kind of keeps track of what variables you're choosing to add to your customized file. We used kind of an analogy from Amazon, except instead of, buying clothes or housewares or whatever, you're shopping for variables and samples. And best of all, you don't have to pay anything. It's all free. So now if I were interested in looking at decision-making power of women in different countries, I might think, well, there's probably other things I should look at, like maybe older women have more say in decision-making. So I want to add a variable for age. So I'm looking at core demographic, and I can choose to add the variable for age and age in 5-year groups. But we see here, this has something that says pre-selected after that. And that means that even if I hadn't chosen to specifically add the age variable, those 2 variables would have been part of my data file. I could ignore them if I'm not interested in them, but we've checked to see what variables are most commonly downloaded by users and added those, so you don't make a data file and think like, oh my God, I forgot to control for age. So that's already in there, along with commonly used variables like marital status. Also, the geography for the samples that you've included, variables that tell you what year is this, what sample is this, what country is this for, and variables used for variance estimation. All of those are automatically added to your data file. Now, I have a theory that exposure to modern media is likely to shape people's expectations in terms of who should be deciding things. So I'm also going to add some variables on media exposure. I'm going to choose frequency of reading the newspaper or magazine and frequency of watching television to see if that also maybe influences who makes decisions. And these are showing up here with the V157 and so on, the standard names on the website. But when you get your data and your code book, it will be just the mnemonics. So I'm satisfied now. I have the variables that I want, and I'm going to move ahead to make my data file. And I'm already logged in, so I don't have to do that. And I'm approved for access for all these files or all these samples that appear in green. So I can go ahead and say, make me a customized data file. So I click on View Cart, and we can see that there are a lot of variables we didn't mention. They have to do again with identifying, well, what sample is this? What year is this? Things for variance estimation and so on. If I go to the 3rd part here, we'll see the samples that or the variables I opted to include for my research question on final say on various matters, and frequency of watching television and reading newspapers. So I'm ready to create my data extract, which means I'm ready to make my customized data file. So I'm going to click on that. And here I can specify the format that I'd like the data to be in that works for me. Now, since I have done this before, the system remembers that I'm a Stata user, but I have other options if I wanted to be working in SPSS or SAS, if I wanted fixed with text, a DAT file, which is the default if the system doesn't know what your preferences are, or a comma delimited file, I could choose that instead, but I'm going to stick with Stata. So I'm going to apply that. And then I have the chance to describe what this is about. So it's if you make a lot of customized data files, it's very easy to not remember what you did on what date. So it's always a good idea to put in a description of text extract for CUGH 2023 on decision making and media exposure in India, Nigeria, Jordan, and South Africa. And this will make it much easier to figure out what this is about. So now I'm going to submit my extract request. And in just a few minutes, certainly while this presentation is going on, I'm going to get an email saying your data are ready pretty quickly. I did a trial run on this earlier today, so I have 2 other data sets that I made in doing a trial run. I could download those data files and start analyzing it right away. And I have other data. I also have there's a code book for each customized data file request that I make. And for older material, there's not a data file. We only keep the data availability for a few days, but there's still the specifications of what I put into my data file, what variables, what samples, what formats, so that it's possible to go back and recreate a file you made earlier, or modify a file you made earlier by specifying what maybe you want to add a new sample, maybe you want to add a new variable. So you don't have to keep voluminous notes on what you did. You can go back and look at your specifications. Okay. Now, the most common problem that people have in using the data once they've made a data file is opening the file. And that's because we, to save space and make it easier to share the data, we send people a zip file. And so you need to unzip the file. And there's a link up at the top here that tells you where you can go to get instructions on opening a data file, decompressing the file. If you don't have decompression software, where you can get it for free, and so on. Now, while we're waiting for the extract to be created, I'm going to refer to some other useful stuff that you'll find on DHS and other IPUMS websites. You'll find, for example, geography and GIS information, like the blanking on this. I'm not a geographer. The shape files for the integrated geography and the year-specific geography. You'll find user notes covering various things. If you are new to IPUMS DHS, I encourage you to look at this user guide that was put together by Liz Boyle, which does a great job of walking people through the website, walking people through how to make a data file, lots of screenshots and excellent explanations. So that's a great resource. But other more specific information, like, for example, someone asked about information on the calendar data. And in user notes, you'll find quite a lot of information about the calendar variables or about the contextual variables, about vaccination schedules and so on. So it's and I just got an email saying my data are ready. So that took hardly any time at all. Then other useful, so if I were to go back there to download or revise my data, we see there's a new file that was just created for the specifications that I gave. So hardly any wait time at all. There's also, if you go to support, a lot of tools to help you in terms of video tutorials, webinars, training exercises with the correct answer at the end, so you can use them as self-teaching tools, or if you're an instructor, have your students use that to learn how to get comfortable using IPUMS DHS data and documentation. Links to the IPUMS user forum and the DHS user forum, and the email to contact our user support team to point out problems, ask for individualized help, give us feedback, and a link to the bibliography of resources that have used IPUMS data, which you can search under topic or data collection, such as IPUMS DHS and so on. And there's a lot more kind of support material like that. If you move out of IPUMS DHS and go use this link to IPUMS more broadly, and on the IPUMS website, again, there is a support. And for example, tutorials. There is there are a lot of webinars that have been done. For example, for IPUMS DHS, there's a webinar on geography. There's tips and tricks. There's one on the calendar data. Again, if you think, I think you're using the calendar data, I encourage you to go through that. I think it will help a lot in terms of sorting that out. That we did in August 2022. So those are pretty much the resources and the way the web works and the way you can make a data file or learn more about variables and what samples are available. But if you can do it for IPUMS DHS, you can also do it for other IPUMS data collections, including IPUMS International and IPUMS PMA, and soon the website for IPUMS Mix will become available. So that's all I got. Any questions?
Thanks, Miriam. We do have a couple questions in the chat, or the Q&A section, not the chat. One of them is a user wants to know if they want a data set for both women and men with the same variables, would they have to download these separately and then combine them?
Okay, well, if you work with household members, that includes everybody. So that will include both men and women in observations for. If you want to work with men and women who are coupled, you know, in union, then there are data sets from the IPUMS, from the DHS program, what they call couple data sets, where they've actually linked husbands and wives or, you know, co-resident partners. We have not harmonized those data yet. I would say it'll be about a year before we can get to that. If you wanted to combine men and women together, I would suggest linking the men's record and the women's record to where they are in the household members file, but that's very tricky because there's not always enough information to confidently link. For more recent surveys, there's a variable called line number. We have a women's version, a child version, and a men's version. And you could use that along with the household number to link pretty confidently. And then, if for older files, the people at the DHS program who know the data very well say it's you can't really link with confidence, especially for children. So you might be able to do that, or you might just want to hold off until we release the couples data, or go to the original DHS files and download the couples data file, which won't be harmonized, but will have men and women matched up in pairs.
Thanks, Miriam. I think we're going to move along just so that we have one more short presentation before we take another break. Please continue to put your questions in the Q&A. We are keeping track of questions that we haven't been able to answer sort of as they come up. And we have that last 30 minutes of the presentation to make sure that we can come back to any of the questions that are still in the Q&A. So we're not ignoring the questions. We're just trying to keep to the schedule. And just a reminder, as I share my screen one more time, we will be taking a short break at 3:05, which is about a minute from now. So hopefully this last presentation will only take about 5 minutes, and then we'll take another 5-minute break at the end before Dr. Sarkar comes back on to talk about more details about the geography and the GIS and the online tabulator tools. This last section here, or this next section here, not the last, I really want to summarize some of the similarities and the differences between the 3 IPUMS global health data collections. And the aim is that this summary can give you a better understanding of which data collection is best for you and your research question. Each data collection has different nuances and strengths that might be important to your research. Across all 3 of these the 3 data collections, IPUMS PMA, IPUMS Mix, and IPUMS DHS, there are many similarities. The Performance Monitoring for Action, the DHS program, and UNICEF Mix have all constructed their data using similar sampling designs and comparable questionnaires. There are a lot of variables that use the same question, the same wording, the same response categories. And in general, all 3 of the data collections do gather nationally representative, high quality survey data to measure similar health and demographic indicators. Oftentimes, as I was saying, the question wording is similar or even identical, and often the universes are similar, if not identical. So for example, women 15 to 49 is a pretty fundamental universe for women in all 3 of the data collections. When there is differences in wording and universes, that's where using that metadata and data discovery tool that Dr. King just demonstrated to look at the different universes, the comparability, the questionnaire text, so that you know exactly what you're getting from each variable for each country and for each year. There are some major differences across the data collections, including which countries are included, what the geographic representation is, when each of the surveys started, and then the frequency of the data collection. The DHS program and UNICEF Mix operate on sort of a 5 to 10 year phase or round cycle, and PMA is a much more faster turnaround survey. So if your research question requires longitudinal data instead of a cross-section, a different data collection might be a better fit for your specific research question. There are also key differences in the availability of those units of analysis and the topics that are covered. Each of the three IPUMS Global Health data collections has data on women, household members, and children, though the specific topics do vary. Some of the features are found in 2 out of the 3 IPUMS Global Health data collections. For example, the birth history is found in DHS and mix, and female genital cutting and mutilation is found in DHS and mix, while the calendar data is found in DHS and PMA, but not in IPUMS mix. So again, these differences might matter to your specific research question. There are also things that are unique to each of these data collections, as we've been highlighting throughout this workshop. For example, the adolescent module in IPUMS mix is pretty unique among global health surveys, and the service delivery panel, infant panel, and longitudinal data that PMA offers are very unique to PMA. A final note, as Dr. Sarkar was describing, we are working to make sure that these projects are interoperable in regards to geography, and the projects can be used to supplement each other. However, we advise against pooling the data between the projects unless you have taken a very detailed look at each variable and the way that each variable is coded, in addition to looking at the universe differences between each variable in each data collection and the geography, the geographic footprint for each sample. In the future, we do hope to allow users to use any data from each of these 3 projects to pool them together to make larger analyses across more countries and across times. However, we are not set up to do this at this time. Even things as simple as the religion variable might look very different in each of the 3 data collections, and therefore we do not advise you to download IPUMS DHS data, IPUMS PMA data, and combine the religion variable without taking a very detailed look at all of that online documentation so that you are not making any mistakes in your analysis due to differences in coding or universes. We are happy to help researchers identify which of the IPUMS data collection is best suited for their needs and point users towards what different topics might be available in each collection. We will take a quick break now. It is 3:10 Eastern time, so let's take a 5-minute break. Again, please put your questions in the Q&A during this break, but we won't be answering anything live for the next 5 minutes. So please feel free to get up, walk away, stretch your legs, get a drink of water. You won't be missing any content. And at 3:15 Eastern time, we'll all meet back here to talk about geography and the online tabulator. All right, welcome back, everyone. I'll pass it right along to Sheila Sarkar.
Thank you, Anna. So, so let's start with some geography and GIS and how you would get this from all the data sets we have been talking about. So IPUMS value added, and how does IPUMS add value to your data? And we have talked about all of these. And what I am going to specifically focus on is the GIS and the geog information in all these data sets and spatial harmonization. So I'm going to throw a jargon in here, but I'll explain as I go along. And then the next part of my presentation is on online data analysis. So before I get started, I'm going to go, so if there is just one takeaway from your from the presentation today, then if you could remember ipums.org, that's our website. I don't know why this comes along. That's the landing page to our IPUMS website. It lists all the project. Today we have talked to you about global health, DHS, PMA, and IPUMS International. So I'll go into all of these projects and show you where you can get the geography information in here. So each of these projects have a tab in the left navigation bar. So if you go there, there is some general description. And here are the PMA countries. These are the variables. And then these are the zipped shape files that are available. If it isn't, then it will say not available. So I'm going to open one of the images and show you what is there in the shapefile. So when you download the GIS shapefile, this is these are the boundaries that you are going to get. So the map image is also a good thing to look at to see what you are getting into, how many units there are, and if that is what you need. So I'm going to go back to ipums.org and go to DHS. DHS has more geography than PMA, of course. And then here are the links. These are the crosswalk files that I talked about, how you can link IPUMS International and DHS. Same logic, you have the variable and the shapefile. We don't have any image files here in the crosswalk variables. These are sample-specific geography as well as integrated geography. Same logic, you have the shapefile, a zipped file that you can download for your analysis. There's another tab that I want to show are the contextual variables. These are the social and environmental variables. I'm going to click on the summary tab where you can find all the GPS clusters that are linked to the rasters that are available. And some of this have been listed here. And you can download this via the data extract system. So each record will have the dominant ecoregion or the average temperature or rainfall associated with it. Here is a brief overview that you can go through, which explains how they have been done. Mix whenever it is out. We hope that is soon. We'll also have a GIS and geography webpage, which will have similar things like the variables and then the maps along with it. So I'm going to go to IPUMS International, the same thing, geography and GIS. This is census data, so it is a lot of countries and it is huge, but I am only going to show the files download page where you have level 1 geography, level 2 geography, sample specific and harmonized. And then you also have a few level 3 geographies. Um, so if you click on it, here there are downloads for each of the shapefiles. IPUMS also has maps that you could do. So if you go through the list, there are, here is a list of all the variables that are available. And then if you click on, let's say, Argentina 1970, this is what you're going to get as a sample specific variable for Argentina. So they're just in a different spot because there are so many of them. So back to my presentation. So what is spatial harmonization? I threw that term out. So in general, let's imagine this is a unit, like a country with 3 units, A, B, and C. Say from 1980 to the 1991 census, A gets broken up into A1 and A2, like very common changes in boundaries. 1 unit gets split into 2 units. So if you are doing changeover study analysis, then how would you like to do change over time? You need to have your units with a similar footprint throughout time. So you combine A into A1 and A2 into A, B, and C. So you get to a unit which is the lowest common footprint for all the units in the country. IPUMS International is also census data, so we care about confidentiality. In this case, we use the term regionalization, where we combine units below 20,000, that's the example in this case, into 1 unit. So if B and C are below 20,000 people, how would you deal with that? You will combine it with its neighbor and you will have 1 unit. So that's what I mean by spatial harmonization. They are standardized through time. So what you get in like as your end result, here is an example from China. You have GIS files. The green lines are the first admin level of geography, it's provinces. And then you have prefectures from 82, 90, and 2000. If they would have all lined up, you would have just seen 1 color just on top of another. But the fact that you are seeing 3 different colors means there have been changes in boundaries across time. So here is a more realistic example from Tanzania, where you will see that there are 3 census years and you see different colors. So there have been changes. We identify the changes with different shades. Here units are splitting into 2 units. But here it's like 3 units were reorganized to create 5 units. So boundaries were moved around more than split. Here is Tanzania again, but from a DHS perspective. And in 96, this was their boundary. In 2015, this red lines were their boundary. And then again, we look at the changes in boundaries. So if you look at your data set, what you want to see is like if you line up everything and imagine that they are the same. So you see Arusha lines up in all the 3 census years, but it is actually not the same footprint. The footprint has changed from 1 year to another. And then you also find a lot of empty units, like this Mayanara suddenly emerged in 2002, but was not there in 88. So essentially, how do you deal with the problem in the data front? You just look at a map and you line it up so you know what was created from what. So here with our Arusha example, Arusha split to form Arusha and Mayanara, which is why we have combined these into 1 unit. So IPUMS does these for you. You don't have to look at a map or do it. All you have to do is use the variable and download the shapefile if you want to use your maps for visualization. So IPUMS distributes sample specific units. So you might not want to do change over time, right? Then why would you want a smaller set of units? So if you want to just study 1988 or 2012, the latest census, then you would use the individual sample specific boundaries. But if you want to study change over time, you want the harmonized boundaries. So you can see 2012 has 30 units, and the harmonized unit actually has 23 units. So here is the same Tanzania example, but from the DHS perspective. So this is more looking at it in a real world, like for Ghana. In 2000, they had 110 second admin level units. In 2010, they have 170 admin level units. So your harmonized geography, the yellow units that have been dealt with spatial harmonization treatment. And then if we count the number of units, we have 102 units. So in basic terms, this is what is like spatial harmonization, and also why you would want to use spatial harmonization. So I'm going to pause here for a little bit and then make sure there are no questions, or if there are any questions before I move on to the online tabulator.
Yeah, Sheila, we do have one question. Can you talk a little bit about how you might layer data using the IPUMS GIS files?
By layering data, I think if you just have the primary level of geography, the first admin level, and then have the second admin level, they should be nesting. That's the term we use, inside one another. I'm not sure if I answered your question, but usually all level 2 boundaries, like admin 2, will be nested inside admin level 1 boundaries. And also if you are overlaying each census year on top of another, kind of the changes visible in boundaries from one census or one sample to another.
Mm-hmm. And one other question that asks, do we have any options for older survey geography to split it to match the newer survey boundaries?
Can you be a little more specific about splitting?
I believe the way I'm interpreting the question is there any way for us at IPUMS to go back and identify people into what the new boundaries would be based on that old data?
That is more computation. And so one thing, this leads into other big issues. Like one of the things with IPUMS data is we don't want to identify people. So if we want to take the older boundaries and the newer boundaries and find out a sliver where some people are located, if we try to allocate people or apportion people into boundaries, then we run into the risk of identifying the people, which we do not want to do. So no, we would not do that.
Yeah, it really doesn't sound like that would be possible. The only way would be to look at something with the harmonized variables or the harmonized footprints, or with the most common spatial footprint. Yeah, thank you. I believe we've answered this person's question. Thank you for clarifying in the chat. All right, those are the questions that we had.
Should I move on to online data tabulator? I think yes. So share screen again. And I am in the IPUMS website, and I am going to demo the online tabulator. So the online tabulator is the Analyze Data Online link here that you click onto. So this is created by some of the statisticians at Berkeley, California. and they run on our servers. And the data run in the background, and you have very fast tabulations. So you can't download data like microdata from the tabulator, but this is a good thing for you to see if the data that you want to use for your research is actually what you have in mind. So it's more data exploration than doing all your analysis in the online tabulator. You can see some quick trends through time, and you can also aggregate to the geographic unit for your analysis. Also, a fair warning, you have to sign up for the IPUMS website, and you have to have access. You have to log in to access the tabulator. So this is where I went. There are single surveys, so you can click on any one of them and analyze that country. But a more interesting thing would be to do the multi-sample data sets. So where you analyze all the data from a country. So I'm going to do Ghana, and there are 3 sample years for Ghana. So I am logged in, so it did not ask me for an option to log in. But if you don't have an account, or if you aren't logged in, as soon as I would have clicked on Ghana, it would have prompted you to log into here. So I am going to do just a basic sex ratio. So sex is one of the demographic characteristics. So here is sex, you just drag and drop it here. So if you have sex and then nothing else in the column, and your data are weighted, as you can see, if you run the table, then here you go, you see a basic sex ratio in here. You see that it provides a graph. It tells you the person weight, your male and female percentages, and also the absolute weighted numbers. And you also see that it opens up in a different tab. So every time you run one of these analyses, it will open up in different tabs. So there's not much of a trend here to look at sex ratios. So what we can do is look at education attainment, and maybe pretend here that the education attainment we we will use one of the crosswalk variables from DHS, and then also attach DHS data to it. I'm not actually going to attach DHS data to it, but leave it in a position where it's ready for you to attach DHS data. So I am going to select education attainment. So select one of the education variables and select education attainment over here. And column I'm going to do by year. And I'm going to filter it by age. Oops. And since I'm looking at education, I will only look at age 25 to 60. And education attainment, I should quickly show that in a tab maybe. It has codes 1 through 4. I'm not going to go directly onto the website because Miriam has already shown the website in great detail. But if you look at education attainment codes, you have 0, which is NIU, 1, 2, 3, and 4, and 9 is unknown. So I am going to go back to here, and I only care about codes 1 through 4. So I'm going to run the table here. And here you can see the results to be a little more interesting. You see a dramatic drop in less than primary and increase in secondary completed. Again, you see year, and you are doing it by year, so you see the trend over time. So now we go back to some disaggregation by geography. So what we are going to do is move to the means tab. And here we can select a dependent and a non-dependent variable here. So here I'm going to select educational attainment. I already did that, and maybe I can tell you what I mean. Educational attainment, I'm going to recode 0 equal to 1, which is less than primary, and codes 2 to 4. Codes 2 to 4 are some primary completed, secondary, and university completed into primary or higher education. So I have this. In my row, I'm going to use the crosswalk code of DHS. Actually, I can show you where I get this code from. So if I go here, geography, IPUMS DHS code, you get your crosswalk code. So that's what I want on my row variable. In my column, I want year. My selection filter, I want age 25 to 30. I leave the person weight and everything else as default. And if I run the table, you can see that it works in minutes. So you can see educational attainment 1 and 2. And then you can see it disaggregated by geography. You can take your results from here and then also download DHS variables, maybe stunting or something like that, and choose your DHS IPUMS Ghana as your crosswalk variable and link the two results. So you will find a lot more cases for education. And then maybe you can figure out if education is related to stunting or not. A couple more things about the tabulator. You can create and download CSV files here. So the result that this table can be downloaded as a CSV. You can change your chart options to color, grayscale, 2D, 3D. Your output options, you can take the weighted N out, and I think you can get a much cleaner table that you can download. Yes. So here is the data tabulator. I'm going to stop sharing here, but we can talk more about it. So it's more a very useful resource for getting your first answer, like, can I use this data for my research, is more the reason to use a tabulator. Any questions on the tabulator before we open the floor for any other general questions?
Just a comment about how helpful that was, Shula, but no open questions.
Shula, we did have a question earlier. Can you just walk through the steps on accessing the tabulator from the IPUMS International website? That process went a little fast, and someone would just like a little refresher on where to find the tabulator.
Sure. I was kind of rushing because I'm looking at the watch and I did want to have some questions. So I'm going to go through IPUMS.org. Remember, I said if you take away one thing from this presentation, that is IPUMS.org, and you can find your way. So IPUMS.org, IPUMS International. And then if you go to Analyze Data Online, it is right here. I am logged in, so it wouldn't tell me, but as soon as you click on anything here, it will ask you to log in. I am like logged in, so it's not asking for my username and password, but yes, the main website and then Analyze Data Online.
Thank you. Open the floor for any questions on anything we've covered. Feel free to type your questions into the Q&A. In the meantime, I wanted to clarify something that has come up in the chat a couple times, and that is we encourage you to go to the IPUMS website, ipums.org, as Shula has said. Search around, look at the different projects, look at the different data collections, see what's available. Use the search feature that Dr. King showed in the web demonstration. See if the variable or the topic that you're interested is available. Maybe it's not on one project or data collection, but it might be in another. If you're truly getting stuck or lost or just not, you think something should be there and you're just not able to find it, that would be the opportunity to reach out to the user support at ipums.umn.edu to answer questions on how to navigate, how to find things. All of the resources that have been shown today are available. There's video tutorials, there's blog posts, there's user guides, all sorts of different resources depending on what your learning style is or how you prefer to learn and consume information. And we certainly can provide help, but the first stop would be to look around and see what resources are available on the web. There's a plethora of resources out there already.
Right. And we did have a question about, like, is there a master list I can consult or something like that in terms of the variables? And I think that's just not really workable, for one thing, because there's so many. I'd have to send you a list of 15,000 variables, and it's not static. The next time we do a data release this summer, well, it'll probably go up to 17,000 variables. So, it's best to, like Anna said, use the search for tool for keywords for topics. Look at the drop-down menus. If you're really stuck or confused, occasionally someone has thought, well, there should be data on this. I'm sure there's data on this. I found an article on it. Where is it? And they're just looking in the wrong unit of analysis or something like that. So, if you do have a specific question, you can send it on and we can probably sort it out for you. But, it's actually pretty fun to explore the data, I think. Of course, we're all data geeks here, but to see all of the possible material and topics there and think about things that you might do or explore ideas. So don't you deprive yourself of the fun of exploring it.
Our user, there was a question about the user forums, and yeah, user forums people are pretty helpful in there too. They answer each other's question. But ipums@umn.edu, if you ever get stuck on anything, they are fairly responsible. They try to answer most of the questions, but sometimes users will have very, very specific questions, like invariably questions on GIS or geography, I know comes back to me for any of these projects. So they do ask us as well if they do not know the answer to a question. And one more thing to add is on the ipums.org page, if you go to support, there are tutorials, lots of them for all the projects. And that is another good resource that you can go to.
There's a question in the chat that, or in the Q&A that says, is there code available for labeling data when we download it in CSV files? Similar to if you were to download the data in Stata format, it already has all of the code for the labeling and the codes. The answer to that is yes, there are code books that will accompany the CSV files or the DAT files, and those can be used to be read into whichever software you're interested in. So yes, we want to provide code books. We want to make it easy to give labels and codes for any of the customized extracts. And on that extract page, you would see a specific column for the code books that would appear when your extract is ready. Yes, we will send out this recording. Absolutely, we will send out resources. This recording, we will link this recording onto our website, and it will be sent out to all registered participants of this webinar.
Someone asked, I think Shula referred to this, but someone did ask about, is there a user forum like there is for the DHS user forum? And again, I want to reiterate that there is an IPUMS user forum, and mostly answered by the very nice, very well-informed, very helpful user support team, though they will refer questions to project managers if they are stumped. And so again, if you look on any of the websites under support, you will find a link there to the IPUMS user forum. And again, people are kind and helpful, and it's all free help. And if you have a really specific question like, I'm confused about this code in this variable in Ethiopia 2016, that would be best to send an email to user support because it's so specific, and maybe we'll have made a mistake and you'll help us correct it, or maybe we can just clarify the answer and help you get past that confusion. So user support emails are really for quite specific questions. User forum broader, but anyone you interact with from IPUMS we're very committed to, supporting our users. So no one is going to be mean to you by saying like, you shouldn't have sent this question here, you should send it there. They really are kind and helpful.
There is a PMA question. I'm not sure if any of us can answer that.
Devin, the project manager for IPUMS PMA, had to leave for a medical appointment. But again, any specific reason for 2 rounds, really we can answer, or Devin or user support can answer questions kind of about the content of the data once it's collected. Decisions about what data to collect and which countries are included and when data are available and so on. If it's from the source, from DHS or from PMA or whatever, that's decided outside of our province. Really, we just take whatever public data are available, or for the census data, we acquire the data and make it public, but we are all about processing after the fact and not about deciding when or how data are collected.
Miriam, do you think you could answer the question that said, can you please repeat how to access the variable codes from the data set? Do you think you could pull up that extract and just show the different columns for the the code books on that, on the extract page?
Sure. Let's see. Okay. Share screen. And
While Miriam is sharing screen, I also want to add that we are all eagerly waiting for Mix to be out live. We have all worked very hard on that, and we want it to go live anytime. Yeah.
okay, let's see. So you wanted like the code book?
Yeah, just showing where you can find that information. And
Right. So I here I've clicked on the code book, and you can see the variables included and the columns. And that is to get here. You can go to the home page, and there's all sorts of goodies in the left sidebar. So you can go to data, download, and revise my data. And that is where you can download a data set that you recently created. You can look at a basic or a DOI version of the code book that's going to have the categories of the variables included. And also you can see the specifications for an extract, so you can see what you requested. So if I looked at my extract here, you can see that, you know, here's my description and my variables. I can show the samples that were included, show the variables that were included. So it's all there in the different columns and hyperlinks on that download and revise data page. Is that what you needed?
I believe so. Please put a comment if you'd like more details. And if you were to download the data specifically into Stata or SPSS or SAS, you would just be able to open that file right into any of those softwares, and all of the labels and codes would be right there without having to go through this extra step of reading in the code book. That would only be for the
Right. I mean, I was a little put off by like, oh, I guess I should open the code book, because I just opened the Stata file. It's a step that I usually skip because I can just see it in Stata.
Mm-hmm. Just a little preview, the IPUMS Mix project is going to have a slightly different extract system than the other projects. We will be disseminating syntax, not data files themselves. There will be documentation on how to access all that. We're going to have a specific IPUMS Mix webinar detailing all of those things. And the code books in that situation are going to be very specific and very useful, specifically for the IPUMS Mix project, but that's a slightly different situation than any of the other IPUMS metadata projects. Well, we're just wrapping up a couple more answers in the Q&A, and so I guess I will make a last call for any questions. Otherwise, thank you everyone for attending. Thank you so much for all of your questions. Really great feedback on the questions and things that we're looking forward to helping you out with your research project and figuring out how to make our data better, a better experience for the users. So please send any questions to IPUMS, IPUMS@umn.edu, or we'll stick around for a little bit longer to answer any last minute questions that come in, but seeing nothing has come in recently, I think this is about time for us to wrap up and say thank you so much for spending your afternoon, evening, or morning with us.
This has been a very lively group, so lots of questions. So it obviously makes us very happy. You know, we are presenting and you're asking questions, so.
Yes, and good questions, really engaged
questions, yeah.
audience. So we were really delighted to have this chance to interact with you.